touched upon surgical asepsis in the last couple of meetings. This is going to be broken up into two different parts. The first part is based on your responsibility as technologists in a surgical or surgical aseptic room. And then on our next meeting, we'll talk about you participating in some of those surgical aseptic procedures. This will be about taking x-rays or taking ultrasound in these aseptic type of environments. Okay, so let's go ahead and begin. As we said, medical sepsis is any method of reducing the number of the spread of microorganisms. Okay, it isn't 100% because again we've eliminated most of it, but not all of it. When we're talking about surgical asepsis, now we're talking about also eliminating the reproductive parts of these microorganisms, the spores. Okay, so surgical asepsis is complete removal of microorganisms and their spores from the surface of any object. These usually partake in procedures, especially invasive procedures, including major or minor. Here we're talking about parenteral medication. This is with the start of an IV. Remember what is your number one protective barrier at the very top? What is it?
Skin.
It's going to be skin. So when we're starting IVs, anytime there is a break in the surface of the skin or even mucous membrane, now there is a chance of a type of infection. So here we're talking about invasive procedures. Invasive imaging. There will be some times when you are going to be participating in a procedure in which, again, there is going to be a requirement of the break of the skin or mucous membrane to perform certain types of imaging, both in X-ray as well as ultrasound. Okay? Again, a small part of what we do is taking images, but most of the time there will be involvement in the break of that barrier to obtain those images. Urinary catheterization. Okay, we talked about the catheter within the urethra. Tracheostomy care, surgical opening here in the throat, and then dressing changes. All these, you are increasing the chances of infection due to the communication from the outside world and the inside world. Okay. Let's talk about zones and barriers. For us to minimize the amount of infection in the environment, a department is generally broken down into different zones or barriers. The objective of zones and barriers is to prevent the patient from infection. Number 2 is to limit the source of contamination. Number 3 is to decrease the incidence of infection. So let's talk about the 3 different zones. In particular, we're going to be talking about the surgical or the operating room. The surgical or operating room. Okay? As technologists, again, we may be summoned into the operating room, the OR, to perform different types of imaging procedures. The first zone that we're going to be talking about here is Zone 1, also known as an unrestricted zone. Essentially what this is your entrance or your waiting area. Here, we can enter the environment in your regular street clothes. Okay? You as employees go to the hospital. Okay, you're not going to be wearing your own surgical types of scrubs. You will be wearing what is provided by the OR unit. Okay, so persons, you're going to be entering this department in the facility in your regular clothing. Zone 2 is what's known as a semi-restricted area. Persons here are dressed in scrub attire with hair and shoe covers. This includes all areas except the surgical or the operating room. So again, you enter the OR department. You're getting ready to start your day. But before you can begin work, you have to go into the dressing room, get out of your street clothes, and put on surgical scrubs. Okay? You know what I mean by surgical scrubs? I call them surgical scrubs, but they're just plain old scrubs. Okay, they look like pajamas. You all know what I'm talking about, right? Scrub attire. Okay? So again, persons dressed in scrub attire with hair in, as well as hair and shoe covers. Now, as we make our way into the surgical or operating room, this is where we got to practice good surgical asepsis. Okay? Restricted area now is persons wearing scrub attire. The scrub attire, again, is provided by the hospital and the department. You're going to be wearing hair cover and shoe covers. Okay? In addition, now we're also going to put on a mask. When you enter an operating suite or a surgical suite, you need to wear a mask. We talked about isolation precautions last week, right? We talked about airborne and droplet isolation. Are we not all carriers of some sort of infection or disease, right? So to minimize that, we, as personnel, are also going to wear masks to prevent any type of infection transference into the patient. Because once the patient enters this room, the procedures that we do there is there's going to be a break in their skin barrier. There's going to be a break in their mucous membrane barrier. Okay? So now we're going to wear a mask. So we're not spreading any contaminants in the air. All right? So zone 1, regular clothes. Zone 2, this is going to be like your waiting area. Okay, but it's outside of the surgical room. You're going to be wearing the scrub, a mask, and shoe covers. Zone 3, we're going to wear everything that's required in Zone 2, but now we're going to put on what?
Mask.
A mask. Okay? Any questions on 1, 2, or 3? We're talking about the operating room or the surgical room. Okay, any questions here? Yes?
For the semi-restricted, so that's outside of the operating room?
Exactly. So let's just take the example, my surgical room is that room in there.
Mm-hmm.
Okay? Right now this would be a semi-restricted area. Everybody's going to be wearing scrubs. Okay? Prior to you entering the procedural room or performing surgical procedures, you got to put on a mask. Outside of the room, you can remove your mask. You can still have your hair cover, and you can have your shoe covers. Okay. Yes.
What about like our department where we're just taking regular X-rays, like an X-ray or a CT? Is that considered Zone 2 or is it?
It is not.
Okay.
It's not yet. Right now, what I'm this is what I'm talking about here is an operating department, an OR department. Okay. Again, separate from the radiology department. So let's keep this separate. Okay, we're talking about the operating department. Okay, the OR. Again, there will be times where our services will be summoned into the OR to perform radiology and ultrasound procedures, and you got to understand how to practice these protocols when entering this environment. Because now, again, we're talking about a room where a patient may be cut open. Okay, so we want to minimize the amount of infections in that type of environment. Okay, any questions? Okay, during a surgical procedure, okay, the doors must be closed. The doors must be closed. And only those that are involved in the procedure are present. You can have your surgeon, your nurses, your circulators, and also you as technologists may be part of this procedure. So only those that are involved in this procedure should be allowed in this room. The door should be closed. The traffic should be minimized. Every time you open up that door, you're wisping contaminants inside the room. So we want to minimize traffic. Okay? Now here's a new term that I want you guys to try to understand. The term is being scrubbed. Being scrubbed. Someone who is scrubbed in a procedure are those directly involved with the surgical procedure and are working around the invasive site. They are directly involved in the surgical procedure and adjacent to the invasive site. Those are the individuals who are directly involved. These are known as scrubbers. They are scrubbed in. They are being scrubbed. Okay? So that's a term that you hear over and over again. Now we're referring to sterile individuals. Okay? Remember back in zone 2. You're getting out of your street clothes and the hospital is providing you with surgical attire, surgical scrub. Is the scrub that you wear, is it considered sterile?
If it's hospital?
No.
It isn't. Okay, it isn't. Okay. Manny, can you stand up for a second? Just come up here for a second. Okay. Okay, this is your basic scrub. Okay, so when you go to the OR department, they are going to assign you the scrub to participate in the daily activities. You're out of your street clothes, and then you put on your regular scrubs. Is this sterile? No. Sorry, guys. It's not sterile, right? Okay. So right now he's not sterile. However, these type of clothing has been sent to a special type of laundry operations where they use disinfectants and other types of chemicals to remove as much of the pathogens as possible. Okay? But it's not 100% sterilized. There's still going to be that 0.1, 0.2%. Okay? All right, go ahead, sit down. All right. So what's going to happen here now is those that are being scrubbed, they're the ones who goes to the sink. They're washing their hands. And it's not just normal wash. You're going to be using special type of antiseptic agents to remove any type of remaining microorganisms in their hand. You've seen it in the movies, right? You've got the doctors and surgeons in the sink, and they are washing their hands, and they're rinsing their arms, right? Underneath the water, and then letting the water drip down their arms and down their elbow. Okay? They're going to enter the operating room. What zone is that now?
3.
Zone 3.
Zone 3. There, they will put on a sterile gown. Okay? These are now gowns that have been sterilized. A sterile gown and sterile gloves to cover their non-sterile apparel. Does that make sense? So Manny will go into the sink, wash his hands, wash his arms, and then he's going to enter the procedural room, and there he will put on his sterile gown and sterile gloves over the non-sterile items. Okay? Now he is able to participate in the surgical procedure around the invasive site. The site where there is an opening between the outside world and the inside world. Okay? You guys understand it so far? So those who are scrubbed in includes the surgeon, the surgical assistant, and the surgical assistant can be another physician, a nurse, or a surgical technician to assist the surgeon with the procedure. Okay? Any questions so far? We're going to get more to the specifics of sterile dress here in just a moment. Let's talk about dress and behavior protocol. This is still, what we're going back here is zone 2. You enter your street clothes, now we're going to put on the hospital sign scrub attire. Number 1, you want to make sure that you're wearing clothes and comfortable shoes. Clothes and comfortable shoes. Crocs do not, they're not part of the attire, but they're very comfortable. Right? You guys know what I mean by Crocs, right? The Croc shoes.
Those funky shoes.
Yeah, the floppy shoes. If you guys ever notice Crocs, they have holes in them, right? They have holes in them. So if you were splashed with any type of bodily fluid, blood, urine, any type of drainage, it's going to seep through your Crocs and come in contact with your skin. Is your skin porous?
Mm-hmm.
Yes, so you can absorb all those contaminants. Even if you had shoe covers on, will it protect you from those spillages and splashes? No, they will still come in contact with your skin and you can become contaminated. Okay, here's the other thing. In a surgical environment, we deal with sharp objects. So if one of those sharp objects comes off the table and lands on your Crocs, is that going to protect you? Okay, I bring that up because, again, I've worked in surgical environments. A blade has fallen off the table and landed straight on my shoe, pointing straight up, with the point pierced on the top of my shoe. It happens. Okay? There have been times where there can be needles and other types of sharp objects on the floor, and you step on them, and yes, they've pierced the bottom of my shoe. Is the Crocs going to protect you from that? So again, we're talking about good shoes that has a covering to it. Crocs are cool. Okay? It's a fashion statement. Okay? But you should wear that in the hospital. Okay? Meticulous personal hygiene. Okay, we're talking about you as individuals. When you come to work, okay, good breath, no body odor. Okay, you've showered. Showering, using mouthwash, brushing your teeth. All those leads to good hygiene because we're minimizing what? We're minimizing the amount of bacteria on our body. Okay, what is BO? You guys know what BO is?
Body odor.
Body odor, okay? Body odor comes from bacteria. Okay? Jewelry and artificial nails. Minimize also the amount of jewelry that you wear because they like to harbor underneath your watches, underneath your ring. Okay? Nails especially, artificial nails. They get underneath the nails and underneath the nail beds. A good place for those pathogens to hide and also grow. Body piercings. Okay, again, this is part of jewelry. Minimize the amount of body piercings and jewelry that you're wearing. Fitted scrub attire. Notice how these nurses, technologists, technicians, doctors, whoever, their scrubs are tucked in. Okay, the reason why they're tucked in is because we're constantly leaning over things. And if we've sterilized an area and you're leaning over and it's loose, guess what your scrub is touching? You're touching the surface of areas that have already been sterilized. So you can contaminate objects. Okay? So we want you to tuck your scrubs in when you're in this type of environment. All hair must be covered. Why? Okay, remember those pathogens? They like to migrate into warm, moist areas. You okay back there? You can move around. If you don't like it there, you can move around. I know it's probably cold.
Freezing.
Yeah. So, all hair must be covered. All right. Even if you have hairy arms, okay, there's going to be a lot of that bacteria in there. Now, me, technically, I can enter zone 2 and zone 3 without a hair cover. Right? Technically, I can. However, to avoid any type of argument and conflict, I put one on anyway. Okay? And I've been called on it a couple of times. I said, show me in your protocol book where I have to wear a hair cover. It's a hair cover. It's a hair net. That's where the bacteria like to harbor. I don't have any hair. Beards, they have to be covered.
How they cover it?
Huh?
How they cover
They cover it with a hairnet. Okay, the mask alone is not going to do it because then it'll be sticking out. So then what they'll do is they'll put a hairnet underneath there and catch it on the flop of their ears, and it should be okay. So you've got the hairnet and you've got a mask, and now you've got nothing being exposed.
Do they do all of them?
Pardon me?
Actually, they do.
They have to. You can't enter a surgical suite in that case. You have to protect all, you have to cover all hair. Okay? Otherwise, and it's an understanding. If you, I mean, there are certain cultures, there are certain ethnic groups where, you know, they're not allowed to cut the beard. Okay? You let it grow. Same thing with the hair. Before you enter that environment, you must, because now you're talking about life or death situation with your patients. If you're not covering those areas, there's a great chance of that patient, because they're cut open, of getting an infection and they could die. Okay? So at this point, it's not so much about cultural ethnicity. You've got to consider your patient's well-being. Okay? And those individuals understand that when they're going through med school, that you're gonna have to do those things. Otherwise, you're kind of entering in the field where it's inappropriate for the patient's safety. Does that make sense? Okay. So all hair must cover. Yeah. So I've seen doctors where they have to wear a hairnet underneath, and sometimes there's 2 or 3. Sometimes there's 2 or 3 up here. Okay. But you got to cover everything. Shoe covers. So shoe covers are basically optional because our foot is already on the ground. It's contaminated. Rule of thumb is anything below the waist is considered a contaminated area. Okay, so anything below the waist is considered a contaminated area. So shoe covers are optional. The reason why we would wear shoe covers is just to protect the covering from any splashes or anything like that. Okay, but it's optional. When you leave the department, we're talking about the operating room department, the OR department, okay? When Manny, he's wearing his scrubs, but when he leaves the department, he's gonna put a jacket on. It makes no sense for him that every time he leaves the department that he has to change scrubs. Leaves and comes back in. It doesn't make sense to keep changing every time you leave the department and come back in. Otherwise, you're a prisoner in there for your 8 to 10 hours, right? So anytime you leave the department, just put a scrub jacket on. One of these. Okay? So now all you're doing is you're protecting your scrub attire. Remember, it's not sterile. Okay? It's not sterile, but we're minimizing the amount of contaminants from sticking onto our clothes. Okay? And the last one here is wear masks in designated areas. All right, do we have any questions here? Okay. Mask protocol. When are you going to wear a mask? What zone?
3.
Zone 3. We're talking about the operating room, the operating suite. The mask protects the patient from droplets expelled by personnel. So again, we're protecting the patient. And we're also protecting us from any type of pathogenic microorganisms in the environment. So it protects us both ways. We're protecting the patient, we're protecting ourselves. When wearing a mask, you want to cover the nose and the mouth without any gaps. Okay, there are no gaps below the eyes. There are no gaps on the side. There's no gaps underneath the mask as exemplified in this particular picture. This is inappropriate. This is acceptable, this is not. Okay, because there are gaps on the top, gaps on the bottom. So whatever you're carrying can escape that area and reach the surgical environment, and now you've contaminated the patient. Okay. So cover nose and mouth with no gaps. Do not cross tie. Cross tying is you're taking the bottom tie here and tying it on the top, and taking the top tie here and tying it on the bottom. So when you look at the back, it's a cross. Doctors and other types of personnel in the department like to cross tie because essentially what you're doing here is, yes, you're covering your face, but when you're cross tying, you're creating a gap on the sides that will allow them to breathe better. When you're wearing a mask, it's very hard to breathe. Okay? Because they're using, again, a type of material that's preventing any type of contaminants from entering through the mask, and also preventing any type of contaminants that you're carrying to escape from your mask. So cross-tying creates purposely a gap on the sides to allow for better breathing. Okay? Whenever we catch that, see personnel doing that, we take them out of the room and we tell them to put on another mask. Okay? Single use only. You've seen this in movies, you've seen this in the hospitals, where you have personnel, after they leave a surgical room, they're walking around the hospital with the mask still hanging around their neck. Yes? Mm-hmm. Have you seen that? And then they go back into the surgical suite for the next procedure, and all they do is take it and then tie it back on. What's the problem with that? Your mask is going to be moist. It's going to be warm. Now you have it hanging around your neck and you're walking around the hospital. It's basically a sponge absorbing any contaminants in the environment. You guys agree? Mm-hmm. And then they decide they're going to use that same mask for the next procedure, and they put it back on. What are they doing now?
Contaminating
They're
themselves.
sucking up all that nasty stuff. It's touching your nose, it's touching your lips, and now you're also breathing it. So once you're done with that mask, toss it and put a new one before entering zone 3. Okay? So for single use only. All right, the surgical environment. The surgical environment, sterile material, equipment, and supplies must be packed and stored in a particular manner considered safe to be used. What does the term sterile mean? It means that there are no existing microorganisms in the environment and the instruments and the equipment that you use. We've eliminated that. So not only have we killed all the pathogens or microorganisms, but we've also eliminated their spores. A break in sterile protocol increases the chance of a patient getting an infection. In other words, touching non-sterile items while wearing sterile attire. As a sterile personnel, those who are scrubbed in, they have to be conscious of their environment around them. Because the only thing that's going to be sterile, okay, they've got their sterile gown, they've got their sterile gloves. The patient is going to be draped with a sterile cover, and the skin is going to be disinfected. However, everything else in the environment is not sterile. In other words, I cannot be leaning up on the wall. I can't be leaning up on the table. I can't bump into things or brush up against things because I'm sterile, but the rest of the room is not. It's only going to be me and the patient. Okay. So when you break that sterile protocol, you're increasing the chances of an infection to that patient. Healthcare personnel needs to be familiar in opening up sterile packages and also donning on sterile attire. So the only thing that's going to be sterile, again, is your equipment table, instrument table that's going to have all these different instruments and equipment, but anything else in the room is non-sterile. Okay? We'll talk about how to deal with these different types of packages to maintain sterility in the environment. Okay, common causes of contamination. Number 1 is contaminated instruments. Number 2 is a contaminated glove. Number 3 is wet or damp sterile field. Okay. When you have a surgical table and all your instruments are lined up, not only do you have sterile equipment and instruments on your table, but you're also going to be dealing with different types of fluids. Saline, heparin, nitrogen, verapamil. All those different things will also be on your table. If there is a spillage on the table, you will see the technologist or the doctor wiping that up immediately. Why? You guys remember what we said where microorganisms like to harbor? Where?
Wet environments.
Wet, yeah, wet, moist, okay, warm environments. So if you have a spillage, that has to be wiped up immediately. Okay. Also, poor ventilation. Talking about ventilation here. As part of environmental services, when EVS or a group of team group comes up to clean up the room, not only are they wiping down the room, disinfecting the room, but they also need to be wiping down the vents. And also the filters on the vents have to be checked constantly too. Top 5 hospitals in Orange County were cited in the last year. I'm talking about top hospitals. I'm not talking about some rinky-dink outfit. These are huge, well-known, well-renowned hospitals. They got cited, 5 of them in the last year, because all of a sudden there was an increase in the amount of infection on their surgical patients. There was a rise. So they were trying to evaluate the department to see what their cleaning protocol and disinfecting protocol was, and it was pretty much